Students, and welcome to the Dermatology Recall session. I'm Dr. Khushbu Mahajan, and I'm here to discuss the recall questions of dermatology. So first of all, I am really sure that your exam went well and you did well. As far as dermatology is concerned, the question seems pretty direct and easy. Now, the aim of this session, as we always tell you, that this is a recall based session. So these may not be the actual questions. And in fact, I need your help for filling out the exact questions, the exact options, which we will then upload on the PrepLadder app. Right? So let's start. Okay, so this is one of the questions that I have received. A 40-year-old male presents with painful genital ulcers along with painful bubo. He had a history of multiple sexual partners. What is the diagnosis? So what is the diagnosis? So if this was the question, it was pretty straightforward. We have discussed genital ulcers, and we know if we have painful genital ulcers, that means multiple ulcers along with painful bubo, we know the answer would be chancroid. Yes, absolutely right. I think there was no confusion here. Okay, so I think there's a confusion with herpes. Now, if they wanted to ask you herpes, they would have given you multiple vesicles or erosions. As I had explained in my lectures, when we are talking about herpes genitalis, it's mainly erosions and vesicles rather than ulcers. Also, the term buboes is used for chancroid and LGV. The lymphadenopathy that we see in chancroid and LGV is called buboes. Both of them are painful, but LGV does not present with genital ulcers. The genital ulcer in LGV is usually transient. So here, if the patient is presenting with genital ulcers and painful buboes, the answer should be chancroid. Yes, so yes, maybe instead of syphilis, chancre was there in the option, but we know chancre is painless, that is out. LGV is out because it presents with transient ulcer, and so the patient usually does not have ulcer when the patient is coming to you. Buboes were not mentioned, okay. So can you help me out? Apart from genital ulcers, what all was mentioned? There was an image. Okay, Sandhya, there was an image you're telling me. What was the image about? So, Dr. Arpit, we understand the question may not be exact, but yes, I understand there was something about genital ulcer. So, if you can help me out with what was the exact question, that would be great. I understand that the options were also same, and there was something about genital ulcers. Perfect. So, there was an image which shows multiple ulcers. Okay, good. What else? Anything else apart from image which showed multiple ulcers? Okay. So probably, and did they, I hope they mentioned in the question that it was painful. And how were the ulcers? Was it like the ulcer that we described for chancroid? Okay. So probably the question was a male presented with painful genital ulcers. There was no bubo and you had an image which shows multiple ulcers. Again, my answer remains the same. In image which showed multiple white ulcers, painful ulcers would be chancroid, because if an image was given, I don't think so you would have a difficulty in differentiating between herpes and chancroid. If it was a herpetic image, there would be coalescing erosions and small superficial vesicles, whereas chancroid would be multiple ulcers. Great. Okay, so the last question on this, were the ulcers looking like chancroid, or did you have a confusion between herpes and chancroid here? I understand now that there was an image and in the question multiple painful ulcers were present. How was the image? It was more like herpes or it was more like chancroid? It was chancroid. Perfect. So I think we are on the same page. An image of a scrotum showing multiple ulcers with probably an undermined edge with some necrotic slough, which was there in the question, painful genital ulcers. So the answer would be chancroid. Thank you so much for correcting me on this question, and I'll make a note of it that there was no painful buboes here. No vesicle-like. Perfect. Thank you so much. So let's move on to the next question. Thank you so much for this. Now help me out with the next question. A child who presented with something like an upper respiratory tract infection or sore throat developed skin lesions which were shown something similar in the image below. And what was the diagnosis? So again, if this was the question, this was the image, and this was the option, I think it was again very straightforward. A history of URTI and a child presenting with papillosquamous lesion, it has to be guttate psoriasis, because we all know that guttate psoriasis is usually preceded by a streptococcal infection. So now help me out here. Did we have the similar question, option, and the image? Okay, so they had also given after treatment with amoxiclav, okay? Yes, I understand that it may not be the exactly same image because it's very difficult to give the same image. It was there in the question. Because as you know, this is a recall session and we are just putting in images for reference. But something similar was that, like that? Same question, different image. Image was not same. So I understand. But was the image something similar like guttate psoriasis, and were the options these only, or there was a confusion with some of the options? Yes, guttate psoriasis is the answer. Image different, question same, and also is the option same? Options were same. So if why am I asking about the options? If they had given you various varieties of psoriasis, various morphological and types of psoriasis, we know that it is guttate psoriasis, which is preceded by a sore throat or which is done after treatment with amoxiclav. History of given for URTI. Good, great. So I think this is quite clear now. Probably there was a different image, but the question was something similar, and you had been given further information in the question that amoxiclav was given as treatment. So we all know that this is guttate psoriasis because only guttate psoriasis presents like this. Right. So should we move on to the next question? His antibiotics history was given, one was guttate, same options. So, oh, okay. Was pus present in the image? Guttate psoriasis does not present with pus. So I'm going back to the question because two of you are telling me that there were pustules in the image. I think no pus. So, okay, then let's not get confused. There was no pus. There was some image with this lesion. Guttate psoriasis is the answer. So let's move on to the next question. A female presented to the OPD with complaints of recurrent lesions on the lips, which are shown below, which is associated with fever. What will you see on a zank smear? So probably the history and the image was suggestive of herpes labialis. You had some vesicular lesions on the lower border of the lips or on the upper border of the lips, basically on the vermilion border. This was associated with fever, and you were asked what would be the characteristic finding in zank smear. Yes. So herpes labialis is the image. And when you do a zank smear for herpes, we see multinucleate giant cells. So again, a very, very direct and straightforward question. Now, I'm waiting for your responses to tell me what's wrong with my question or the image. Perfect. So I like your name. You're a future obstetrician. So I hope you get what you really want. So exact image and question. So if it was the exact image and question, we know we are dealing with herpes labialis here. Herpes labialis is caused by HSV. And we know when we perform a zank smear for HSV virus, we can see some acantholytic cells. And the most important thing is we see multinucleate giant cells. Henderson-Peterson body is seen in molluscum contagiosum. Acanthocytes are nothing but zank cells, which may be seen, but they are more characteristic of pemphigus. For herpes, if I have an option of both acantholytic cells and multinucleate giant cells, I will mark multinucleate giant cells, right? Or owl eye appearance is seen in coilocytes, which is seen with Watts or HPV, right? Ma'am, they look like upper border, everything perfect. So I think it was something similar. So we can come back to any other question which was there. Let's first discuss what I have. Then I would want you to tell me what other questions that we have. So this, I think we all agree it was something similar to this, and the answer would be multinucleate giant cells. The next question that I have is a 30-year-old pregnant female started developing brownish pigmentation over the face as shown in the image below. What is the diagnosis? So probably there was a pregnant female and she developed some brownish pigmentation of the face. We know that the answer here would be either melasma or if they had given cloasma. So any of these could be the answer here. Obviously, melanoma will not present like that. Normal suntan does not present with macules. There is a diffuse pigmentation. BCC does not present like this. So here, if this was the question, something similar image, answer would be melasma or cloasma. Sun exposure. So thank you very much. So you're telling me there was no pregnancy. So cloasma is out. And you are telling me that there was history of sun exposure. So female after sun exposure develops a brownish pigmentation. The question becomes more easier that it is melasma. Sun exposure. So 40-year-old, thank you so much. A 40-year-old, and I think one of the options you're telling me was nevus of Ota. So no, nevus of Ota is not bilateral. It is not related to sun exposure, and it is not present in a 40-year-old. It will present earlier. Perfect. So which question are we talking about? Neutrophil was in the option. I think it's not related to this. So Dr. Real Bharat, in first question, small, multiple, circular in the group in the image was mentioned. Okay. Can you elaborate, Dr. Real? Can you give me the exact question and the options? It would help me better. Okay. So thank you so much. All of you are telling me there was no pregnancy, but sun exposure. My answer remains the same. So it was quite easy. A pigmentation after sun exposure, it is melasma. So I'll move on to the next question now. Okay, so image was something similar to nevus of Ota, but okay, nevus of Ota is unilateral and melasma is usually bilateral. So I hope in the image you had that clue that maybe it was around the eyes, but in nevus of Ota is more bluish, it is more unilateral, whereas melasma is more brownish and it is bilateral. Yes, I'm coming to the next question. A young boy came to the OPD with complaints of severe itching at night. You see burrows which were present. I don't think so. This should be such a direct question, but if it was, well done for you. So if they have mentioned burrows, itching at night, you know we are dealing with scabies, and obviously scabies is caused by Sarcoptes cabi, which is a mite. It's like the most easiest question that I have read. But now I'm waiting for your responses. Sarcoptes cabi. So was the option was Sarcoptes cabi or Ichmite? It was on both sides on the image. So yeah, I think you're talking about the melasma question. So it was in the both sides. So we know it is melasma. So, okay, they had given Sarcoptes cabi, but I think the question was something similar. Either Sarcoptes cabi or Ichmite was there in the option. So still my answer remains the same. Mite was there. So again, I think you had itching at night, you had burrows. So you all know that this is caused by scabies, and scabies is caused by Sarcoptes scabi, which is an itch mite or which is a mite. So any of this is an option, that would be the answer. But I hope the question was something similar and they had asked you about the causative organism, right? I think you guys are talking about this option. So I've written suntan as the option. Suntan is an option. But see, suntan will usually not present with bilaterally symmetrical pigmentation. Suntan presents with more of darkening of skin color in general. You do not see specific macule, so don't get confused over there. Nevus sophoта is unilateral, so melasma would be the better option here. Okay, so here we are clear about this question. So I have these questions and now I'll wait for you to tell me if you have any more questions which you think were there from dermatology and we can quickly discuss them over. So please tell me if there were any more questions or you can tell me the topics from which the questions were there. So I think the questions that I've already discussed, we'll move on from there because they have been discussed in quite details. But if you have any other question which you feel was there from dermatology, I will wait for a minute so that we can discuss those. Okay. So there was a question on xeroderma pigmentosa. So I'm waiting for your responses. So was there a question on xeroderma? Okay. So there was one image question with nodules on whole body. Okay. A question on contact dermatitis. Okay. Okay. So can you tell me the exact question on xeroderma? Okay. You had acute exanthematous pustules all over the body. So that is if there were pustules all over the body and there was history of antibiotic as someone was telling me, then probably the answer would be AJAP or acute generalized exanthematous pustulosis that happens after a drug intake, can be after antibiotic also. So there was a question on dermatitis herpetiformis. Nodules on head. Can you elaborate on this question? See, if they had given you that there were pustules which developed over the body after intake of drug, that is AGEP or acute generalized exanthematous pustulosis. So there was one question, he had pharyngitis with blood in urine and there were pustule or rash all over the body. So see, if something similar was given, I can only think of Hinox-Conlin purpura here. HSP can present with sore throat, with blood in urine and with a purpuric rash all over the body. Celiac disease. Okay, so the question which was, I think, associated with dermatitis herpetiformis was that celiac disease is associated with which skin condition? Celiac disease is associated with dermatitis herpetiformis. Again, we all know that it is a gluten-sensitive enteropathy that DH is associated with. Okay, and probably there was a question where there was blood in urine and along with sore throat and some purpuric rash on the body. So this is HSP or Hinox corneal purpura. Okay. I think these questions I can understand. The nodules one I'm still not able to understand. So okay, I think you all are getting confused. Someone is telling me even EM was also there. So probably in this HF question, there was an antibiotic which was given. And if there were pustules, you have to mark HF. They may have given EM as one of the options, but if EM was the answer, they would have given you target lesions on the image. Okay. So there were some nodules which were given on the frontal bone. So if they were just boy came to the OPD with short stature, defective double strands break with multiple skin tumors. Okay. There was some boy. So see, probably xeroderma pigmentosa question, they can give you a boy who had come with a tendency for multiple tumors. So xeroderma pigmentosa, there is a tendency for multiple tumors. Short stature, telangiectasias on the face, and multiple tumors are again associated with Bloom syndrome also. So I think we are kind of we are getting different options. Boils are caused by which organism? So boils is nothing but pyoderma or folliculitis of furuncles, and they are caused by Staph aureus. Okay. So if there was something like short stature, telangiectasias, malignancy, then Bloom syndrome can be the answer, because Bloom syndrome is associated with nucleotide excision repair defect. So probably if they did give you double strand breaks with short stature, with tumors, then probably Bloom syndrome can be the answer here. So there was probably a question on Bloom syndrome. So yes, if there was a question, I can't believe you had so many questions in dermatology. So yes, boils are caused by Staph aureus. Okay, multiple scabies question we have already discussed. So you were telling me there was some question on boils. So yes, Staphylococcus aureus would be the answer here. Multiple nodules on scrotum also. Are you sure? You told me that there were multiple ulcers on the scrotum. So I think we have already discussed that. We have already discussed a question on pustular psoriasis. So probably the one that you're getting confused is pustular psoriasis and AGEP. I will specify if they'd given you a course of antibiotic after which patient developed generalized pustules all over the body, it would be AGEP, not pustular psoriasis. If they had to ask you about pustular psoriasis, they will give you specifically Cotar or steroids. Okay. 10 plus questions on dermatology, okay? But I think we are talking about more than that here. But I guess so. So on one question on head, which is like big chirion, pus and big nodules. So see, on head, there can be multiple tumors. Pilomatricoma is one tumor which can present on head. There can be multiple steatocystomas which can be there. There can be epidermal inclusion cyst which can present with swellings on the scalp. So I hope there was something more to that question. So if you can elaborate on that question, well and good. So yeah, or if there is any other question that we've not discussed. So because we have to finish up the session now, the next educator may be waiting. So I will just wait for a minute more. If there is any more clarity on the question or any more question which we've not discussed, please tell me about it. So about this nodules question, maybe what you guys can do is, I'll write my email ID here. if you can pick out an image from the Google and tell me how did the image look like probably, and try to find out the exact question, I will definitely reply you back. So this is my email ID, khushbu1401 @gmail.com. So maybe you can put nodules on scalp and see what kind of question or image was given to you. Mail it to me and I will try to help you out with the answer there. Right. So I'll close the session here. It was lovely chatting with you, and thank you so much for giving me so much inputs and so many more questions and options. And since you have told me all of this, I'm sure you've done your exam pretty well. So hoping to meet you guys in person someday, and all the best, and take care. Sleep well.